family, and you don't do an in utero test, do you create a liability? No, if we reach that point?
Well, there are certain tests that are available. I think you'd want to talk to an OB guy about this, but there are blood tests that are available to screen the woman for various genetic disorders. There are also ultrasound techniques, and some of the ultrasound techniques, I just had occasion to attend a conference in Los Angeles, Good Samaritan Hospital, and they had a specialist from Germany who uses very sophisticated ultrasound. And just absolutely remarkable was what they're able to see in the fetus of babies with the latest technique in ultrasound. I mean, they can see detail down to 1 and 2 millimeters. Detect deformities of a baby's heart in utero quite early in pregnancy.
Wow.
Predict babies that are going to have like Down syndrome, serious defects like that, very early in the pregnancy.
Are those inexpensive machines that do that?
I'm sure they're quite expensive.
And that's part of the problem. That's why you say
I think that
costs are going up exponentially.
Well, it's really remarkable now that this is viewed as part of the problem. I mean, when I came out of medical school, if you told me that there were going to be all these advances in science, we'd thought that's great. But science has run into economics. And you phrased it pretty cogently. That is, the science is apparently going to be out there for a lot of advances. The problem is going to be is using this science in an economical fashion so that people can take advantage of it. I think really it's just going to cost more. I don't think there's any getting away around that.
Well, I think if we got rid of the Homeland Security and saved ourselves $90 billion, that'd be $90 billion to spend on these medical advances, helping people rather than murdering and slaughtering. And I promise you I wouldn't get into that, didn't I? I'm sorry, it just really bugs me that we're bombing Islamic weddings. But getting back to the subject, I'm sorry, spank me.
Well, let's get into a couple of more problems. Then after that we get to the MSAs. Okay, another problem is that there are probably 40 million people that don't have insurance in the United States. And this is a problem. Now, the politicians always talk about this, and you get the impression these are 40 million people that don't get any health care because they don't have any insurance.
Hey, that's me. I'm one of them. Well, I'm one of the 40 million. I can't afford it. It's just ridiculous.
Well,
so I just stay healthy and always have a doctor who's my friend.
You hit the nail on the head. Staying healthy is the cornerstone of medical economics.
I don't smoke. I don't drink. I avoid Republican conventions. I avoid Democrat conventions, and I try to stay healthy. But go ahead.
Okay, you threw me off here. Okay, well, the problem with the 40 million people is you hit the nail on the head again, BJ. That is, most of them are fairly healthy. The only problem is it's these healthy people that are supposed to be paying premiums to keep the rest of us who are developing problems as we get older. Because we're going to have two groups of people. One group of people doesn't carry any insurance that are healthy, and the rest of us are getting sick and have to pay outrageous premiums. But somewhere the rubber has to hit the road here with this business. It just doesn't make any sense to have an increasing number of people that are uninsured. I think another thing we want to mention is that really with the insurance companies right now in the federal government, you have an adversarial system. That is, you have physicians who are providers, and you have insurance companies and the government that are the payers. And the two are in an adversarial relationship, and the patients are caught in the middle of a really bad crossfire here because of the prices are controlled by the government and insurance companies, the regulations are being passed down by the government, and this puts the providers, the physicians in the hospital, in a pretty bad position.
It does, and that's why a lot of them, I've heard some, in fact, I know a doctor who left surgery. He was a general practitioner in Los Angeles surgery. He went into writing books. And he's writing books about healthcare costs.
Did you say he's taking book or writing?
No, he's writing books about healthcare costs and the dilemma that you're going to experience in 2 years, which is going to be a crisis. I know a dentist, the dentist I used to go to here lives in Napomo, just quit dentistry, and he's writing books.
Oh, okay.
I
Well,
mean,
I'm not writing any books yet.
but you're
I'm-
going to
I'm
stay
still
in practicing.
practicing.
Good.
Until
Dr.
they
Statti.
drag me out of my office someday.
Okay,
Okay,
so
let's talk about MSAs.
okay,
Uh,
medical savings accounts. Now, I
right.
never heard of this until
Right.
you and I were at lunch a couple months ago, and I had never heard. I thought you were dreaming, but here's the brochure on it. If you didn't get this already, and in this brochure, and it's available from Midstate Bank. There are 70. It started with a 4-year program. Originally, the Congress. This is a congressional act. You can write off your taxes. And it's kind of interesting because what you do is you go and you open up this medical savings account, and every month you put in so much money, like a savings account, right?
right, exactly. It's well, you put it in once a year.
Once a year or once a month?
Once a year.
Okay, you put it in there, you open it up, you put the money in there. At the end of the year, you collect all your bills from going to see Dr. Statti
Right.
or Dr. Okerblom or Dr. Mendoza or whoever. And you take all the legitimate medical bills, you go to the bank, and you say, I want to take this out, and that's tax deductible.
Right. Well,
It's tax deductible.
Yeah, here it is. It's a tax deductible program. Now, I have an enlightened accountant, and she got me into this about 4 or 5 years ago. So I'm a single person. So I was able to put aside $1,560 per year in a savings account. And I've done this now, I guess I'm going on 7 years. It's a medical savings account. It's like an IRA. That's your money to spend as you see fit. Now, during the course of the year, if you have medical bills, now you have to have insurance. This is not medical insurance.
Yeah, it's not medical insurance.
This is supplemental. And what it does, I think, really, it's very easy to understand. It's, the buzzword now is transparency. Well, this is transparent. It's your money in your bank account. And if you decide that you, for instance, you're in an HMO and we'll say you happen to have a medical savings account. So you've got X number of dollars in the bank, and you feel you want to see a dermatologist for some reason. But your plan, you go to, usually you go to a gatekeeper, and the gatekeeper for some reason, and it may be perfectly legitimate. I mean, he scientifically may say, I don't think you need to see a dermatologist, but you feel like you want to see one. Well, you have the money to do that. So it gives you the liberty, the freedom to make these
your
sorts
health
of
insurance
decisions.
may not cover it.
Right.
So you go run up the expense that you withdraw at the end of the year
right.
from your medical
keep
savings
track
account, and you can still deduct it.
What you do is at the end of the year you accumulate your bills. You went to the dermatologist. Now what I do is I take my bills to my accountant. She fills out some sort of form, and she says, okay, you can go to the bank now. You can withdraw $3,000 from your medical savings account. So this is money that you spent during the year. So now you just reimburse yourself from your medical savings account, and then you can contribute. The same time. I guess if you wanted to, you just go over and contribute your next year's funding.
Now, what's interesting is you're single. You've raised all your kids are grown up, and so you're living a single life. But if you were married, the annual deductible is between $3,200 and $4,500 for a family. I'm reading from the brochure here. And your out-of-pocket expense maximum is $3,200 for an individual.